Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On May 22, 2026, the US FDA granted an accelerated approval for HEPCLUDEX Bulevirtide, an injectable polypeptide therapy for the treatment for chronic hepatitis delta virus HDV infection in adults without cirrhosis or with compensated cirrhosis. Now, let's dive into this medication in more detail. Bulevirtide, brand name HEPCLUDEX. This medication was approved by the US FDA on May 22, 2026, and indicated for the treatment for chronic hepatitis delta virus HDV infection in adults without cirrhosis or with compensated cirrhosis. The HDV infection is a liver infection caused by the hepatitis delta virus, and it can only infect people who already have hepatitis B. Chemically, Bulevirtide is a 47 amino acid polypeptide with all chiral amino acids being the L configuration and S stereochemistry, along with a fatty acid myristoyl residue, which is a 14-carbon saturated fatty acid and highlighted in red at the N-terminus, and a amidated C-terminus, which is highlighted in blue. The molecular weight of this polypeptide molecule is 5,398.9 Dalton. This medication is available as a acetate salt form and 8.5 mg as a lyophilized powder or cake in a single-dose vial, and requires reconstitution prior to subcutaneously injection administration. Recommended dosage 8.5 mg subcutaneously injection once daily. Notably, this medication carries a US box warning, post-treatment severe acute exacerbation of hepatitis D and B. Mechanistically, Bulevirtide works to inhibit HDV infection by binding to the HDV receptor sodium taurocholate co-transporting polypeptide NTCP on the plasma membrane of hepatocytes, blocking HDV attachment to the NTCP receptor. Pharmacokinetically, Tmax, the mean time to reach maximum concentration of Bulevirtide is 3 hours. The absolute bioavailability is 57%. Protein binding is over 99%. The medium elimination half-life is 3 hours. Metabolism. Given Bulevirtide is a 47 amino acid polypeptide, it's metabolized into amino acid by peptidase and catabolic pathways. The major elimination route is excreted as smaller peptides and amino acid. Drug-drug interactions. Bulevirtide is not a safe enzyme or transporter-mediated inhibitor or inducer at clinically relevant concentrations. No clinically significant drug-drug interactions are expected. Contraindications. Currently, there are no contraindications listed on the prescribing information. The most common adverse effects greater than or equal to 10% for HEPCLUDEX include injection site reactions, headache, abdominal pain, fatigue, and pruritus. Here are the key references which I have used to prepare for today's video. The US FDA new drug approval updates for 2026 is a very valuable resource. In addition, most of the medication information which I shared today is based on HEPCLUDEX prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.